Hi, everyone. Welcome to our February Ask the Expert interview. So happy today to have Tracy with us from the American Heart Association, and she's going to discuss February being Heart Month. And so we're so happy to have her. Welcome, Tracy.
Well, thank you for having me. I really appreciate you reaching out and us having the opportunity to shout out to the world about our Heart Month. We totally love February. Everything's heart related that way. Everything's red. We just recently had our Wear Red Day, which is always the first Friday in February. Unfortunately, here in Kentucky, we had like a snowstorm and everything else, or an ice storm. Wherever you are, we either had one of the two. So we wasn't able to get out as much as we like to, but that's a recognition day to talk about and to shout to the world about heart disease being the leading killer, especially among women. And that is kind of one of the prevalence we like to talk about. So we totally appreciate you having us on this great Heart Month. So thank you.
Well, thank you. So first of all, can you just tell us a little bit about the organization and then what parts of Kentucky you all are located in, and just overall information about the Heart Association?
Absolutely. If you know the American Heart Association, we've been around almost 100 years. We got 2 more years where we're 98 years old. We are a research-based organization, and to push our mission forward, we're continuing to come up with new and innovative ways to help people who've had heart conditions or to prevent heart conditions so it's constant. It's a national organization and a worldwide organization. So we have many moving parts within the American Heart Association, and our true mission is to be a relentless force for a world of longer, healthier lives. And that's what we all boots on the ground here in Kentucky are doing locally. We have 2 offices here in Kentucky. One is in Louisville and one in Lexington. I am out of the Louisville office, so I work out of the Kentuckiana is what we call it. So it's that southern Indiana area that we still service. And then I also work all in Western Kentucky. So I have Bowling Green, I have Paducah, I have all of the wonderful counties out in the western part of the state, where my counterpart out of Lexington kind of runs all the community impact that we do in the Lexington area and all of the Eastern Kentucky. So we do service the host state, and we look at truly finding ways and innovative ways to make sure that we are touching everybody throughout the state.
Yeah, perfect. Can you share with us some statistics about the prevalence of heart disease and strokes in Kentucky, maybe kind of versus the overall United States?
Yeah, heart disease is still the #1 killer, unfortunately. And I think over the last year, 2 years that we've continued to hear COVID being really impactful and how devastating it is for us here locally and nationally. But even with that, heart disease is still the leading killer, and it's the leading killer not here locally and nationally. With stroke, we're coming in third for that. We still have third and fourth, kind of the statistics are moving around a little bit, but it's still really prevalent here. The way we compare to the rest of the nation is we are a little bit higher in death rates, unfortunately, here locally. And not surprising, like when you think about it, because, here in Kentucky, we are one of the most unhealthiest states, unfortunately. And we are really trying to make some really great policies changes to help implement and move the needle in the other direction for that. When we talk about locally, we have over 250,000 people here just in our metro Kentucky area and within the Louisville area that have been told they have high blood pressure. We have 1 in 5 people that are food insecure, and that was before the pandemic. And that's 7% higher than our national average. So if you think about like trying to be healthy, you need those healthy foods in order to be healthy. So that's a key factor. And then, of course, we're in a tobacco state. And unfortunately, as you have seen, the vaping epidemic, as we always said, we had an epidemic before we had a pandemic within our school systems, as our youth are back on tobacco. We almost had that eliminated until our vaping started to come around. So all of those play into factors of how Kentucky continues to be one of the unhealthiest states.
Mm-hmm. What type of programs are offered through the American Heart Association to try to offset all the things you just talked about?
Yeah, I'm glad you said that, or even asked that. Over the last, well, when the pandemic actually hit, AHA really took a step back and said, what can we do to make more impact in our communities and make this a healthier area? And so taking a little narrower focus, I think we were trying to tackle the ocean at one time, and now we're like, what can we do? What can we spearhead to make it so they honed us in on 4, and I always throw a 5th priority area where we're making some really good movements through. But doing that through the lens of health equity. We've kind of looked at social determinants in the prior to COVID, but taking a larger look through the health equity lens and what can we do. And those 4 focus areas is the tobacco vaping that I've talked about, specifically within our children and within the schools. Taking a look at policies within the schools. And so if your child is in a school, you might want to take a look and say, you know what, this can happen to my kid and they can be vaping. And sometimes we don't even know it because the devices can be so hidden that we're like, oh, that's really a vape. But taking a look at the policies they have, a lot of them are very punitive, in fact, and we want to make these supportive policies because we don't want to add a punitive punishment upon something that we really need to be supporting these students because it is an addiction. So we're looking at all of our local school districts and saying, what can we do to help stop this? And policies are that, and it's making that education within the school system. So that's one, and just because I had touched on that prior to. Another one is the food insecurity we have touched on prior to. And we want to make sure that the social determinants that everyone has access to have fresh, healthy fruits and vegetables. And what does that mean? I think we're kind of centering in on some of our food banks in our areas because they are supplying some of the vital needs for our most underserved populations, and taking a look at what are we supplying the foods? What are people donating to these? Can it be healthier? Can we make this lower sodium? Can we get equipment in there so they can have some fresh foods that are stable and they can be able to give those out? So taking a look at that access piece, and then of course that's really a key factor, but we also have a policy, we have a state advocacy director that are looking at how can we get more dollars into our state to help our WIC and to help our SNAP program. So taking a look at it at a lot of different angles. So that's kind of 2 of our focuses. Another one is hypertension, which you're always going to hear, and you're going to know that like, oh yeah, they work on hypertension because blood pressure is that silent killer. And we want to make sure that that is screamed out to everyone. So we do a lot of work with our federally qualified health centers here locally and throughout the whole state to honing in on how can we get hypertension control rates better throughout the state because they're pretty low in some of our areas. So what does it mean? We're doing self-monitoring blood pressure programs within there. We're constantly building upon what's the next innovative thing we can do for that hypertension control. So that's another one. Women's health. Specifically women's health is a whole category in its own that we're focusing in on. And because women, we think breast cancer is the leading cause of death, but then women, it's still heart disease because women are caretakers and they're constantly taking care and they're okay. They put their own health off to take care of everybody else. So what we want to do is really ensure that women are taking a step back and putting that mask on themselves, like when you're in the flight, and taking that message and thinking, if you don't take care of yourself, you can't take care of everybody else. And when we talk about heart disease and heart attacks, they present themselves differently in women than they do men. It's not all the elephant on the chest, the left arm. Women typically, their heart may present themselves with back pains or different things that come up. So we talk constantly about knowing your numbers and what can we do. And in another area of women's health is we are looking at that maternal health and looking at how can we do some better prenatal care and knowing your blood pressure going in, because the statistics over the last few years have went up 147% of maternal death rates And and most of that is due to cardiovascular related issues. So we want to make sure that we're really honing in on some women's health and working with boots on the ground with the people out there and the centers working with them. So I know that was a lot of information that I just threw out, but I wanted to really give a high level overview of where the work with the Heart Association is right now.
Mm-hmm. Yeah, very good. Here locally in Louisville and in your other markets, are there any resources that you all have available to help encourage a healthier lifestyle? I don't know if you all have support groups or just what resources do you all help provide?
Yeah, that's a great question. We have a plethora of resources. The Heart Association is full. I think I'm still finding out new things every day. And I've been with the Heart Association for over 4 years, and I'm still like, oh, wow, we have that. That's a great tool. Our website is heart.org, and it's just like that, heart, HEART.org, has so many good resources on there, from healthy recipes to the importance of sleep to how to manage your blood pressure. What does it mean? Gives you the color charts of your blood pressure, gives you all kinds of fitness ideas that you can do within your own community and within your own household. I think through the pandemic, we became really good at doing some virtual information sessions online. So we continue to have those. We are starting a new support group or survivor group and a support group within the organization for here locally, because we really haven't had one. And what we're seeing is, and it's bubbling up, that there is that need of more information that we can have.
Yeah. So I know you all have all kinds of events to kind of promote your work. So just tell us about a few of your events that you all have.
Well, we are centering most of our work right now about issue-based fundraising. So we're really looking at it as trying to get away from event focus, but the events are our celebration of all the good work we're doing within the community. So we do have our staple 4 events that we always will put on. We have our Go Red for Women luncheon, and we have our Heart Fall, which is coming up, which we're really excited about. And then we have our Heart Walk that's usually in the fall. And now we're going to do something new that we started last year, is Cycle Nation. So we have a cycling event that'll also be in the fall as well.
Awesome. So what can individuals do to help support AHA?
I think coming out, volunteering, we are always looking for new volunteers to help spread our message. And one of the things that I didn't kind of overlooked in the earlier is our CPR. And what we're trying to do around our CPR is having a community of lifesavers, because we know that it is time saved. If we can get hands on a person, they are more likely to survive before 911 gets there, before our first responders get there. So we want to train everybody in CPR. So if your organization or if your employer, if you're not being trained on hands-only CPR, reach out to us. Be part of our community of lifesavers. Come out to any of our events, whatever you would like. Build teams for our walk. Come out to our Cycle Nation event. Come to our ball. Our luncheon is wonderful. Do that celebration. Come celebrate all the work that we have.
Perfect. And then you mentioned in the very beginning that you all are a research-based organization, and I know a lot of your funding goes to support that. So can you give us any examples of some of the research that is funded through AHA?
Yeah, absolutely. One in particular, near and dear to my heart. My father had a heart attack. Actually, he's had 2 heart attacks. And because of the research from AHA, he was able to get stents put in, and he is still with us here today. And over the years, I look back and think, this is the reason I work here, because that is my why, is why I'm here. And I say we having because of that. 10 years ago, when you would have 10 to 20 years ago, when somebody would have a heart attack, you were going to be in the hospital for a long stay if you even got out of the hospital. Nowadays, we can get you into the hospital, get you out of the hospital, sometimes getting a stent in that same day and getting out that same day. So the research that we have done has really, truly impacted me personally. And I think it continues to evolve. Also, when we talk about our CPR, we went from the CPR with the breaths, with everything you had to do, through the research that we've learned over the last 10 years is hands only. All you got to do is get that heart pumping, get that blood pumping through, because there's enough oxygen in your blood to make it till the first responders come and are there. Because our response time here locally is about 12-minute response time, and you have enough oxygen in your blood. So that's just a tip of the iceberg of all the research. We've got tons of great, if you had a stroke, the research that they have now, the medication that they can do to break down those clots in your brain is amazing. And all of these, because we know time saved through stroke is critical. So these drugs, getting these drugs into you really quickly is key. So all of that research plays into the part of we are truly making an impactful difference in my life personally and throughout our community.
Mm-hmm. Yeah. I'll share one personal, not directly funded through AHA here, but I'm sure it helped. So when I was 9, I had rheumatic fever and caused defect to a heart valve. And when I was 16, I had that valve replaced. And then in 2014, had a melody valve, which is just a fancy stent put in, and I was in the hospital one night. So wow. I can attest to that, research has helped save my life many times.
People.
So I'm appreciative of all that you all do, just personally, just wanted to share that with you. And thank you for being on with us today. And then I'll just let you share anything else that you want to, but I appreciate you being on.
Well, thank you for sharing your story. For one, we love to hear the stories because that truly drives our mission. And when we talk about being that relentless force, we want to be there for people like my dad and me and you and constantly. So I appreciate you sharing that story. One of the things I would add is we don't do this alone. We are a volunteer organization. So it is the community and it is the collaborators that we work so closely with to make such impact within our community. There's so many departments within our organization that are working on quality improvement and working with the EMS and the hospitals to get better care so that we know before you even hit the door what has already happened and that we can get you in and out healthy. Mm-hmm. So I think we don't say it enough that we appreciate our community and the support that we get from all of our community partners.
Yeah. Well, again, thank you, Tracy, for being on with us today, and thank you for all that you do and everyone in Kentucky and throughout the United States that works for you all and helps fund the research that I'm definitely thankful for. So thank you.
Well, thank you, Jennifer. Thank you for having us.